Hello, this is Dr. Gay from First Look MRI, and this is a 20-year-old female who has complaints of right-sided pelvic pain and now more recently rectal pain. It's been intermittent for several years. Her uterus on this MRI scan is normal. This is her fundus. We can see her endometrial cavity here. There's no endometrial thickening. There's no uterine mass. Her cervix is down here looking normal. But she does have something. If we roll off to the right side, here's the left side, a little bit of fluid behind the uterus. As we roll off to the right side, we see the main problem. There's fluid on the right side by the uterus, and I have an arrow pointing to a thing that looks like an egg here. This is a cyst. Looks like a simple cyst, very clean, sharply defined, homogeneous. So a simple cyst. When we see cysts in young people like this, typically we think of an ovarian cyst, benign ovarian cyst. They can grow and sometimes leak, and it looks like that is probably what is going on here. We have arrows pointing to this ovoid structure. Oftentimes the cysts are more towards the middle or higher up in the pelvis. Her cyst happens to be low in the pelvis and in the back. This is her rectum right here, so it does touch the rectum, and there's leaking fluid. Here's the cyst, and the other small arrows point to a little bit of leaking fluid. So the leaking fluid surrounding the rectum. So we imagine that the ovarian cyst, because of the mass effect and leaking fluid, is causing the symptoms related to the rectum. But a very common finding here, and again, hers is just in an unusual position, low and back, and probably causing her symptoms. One more quick view, straight on, to see the same anatomy and stuff. This is the right ovarian cyst, and we see the uterus displaced to the left, and below that we see the rectum and a little bit of free fluid around that. And that's it. Thank you so much.